It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Thanks for joining us, folks. I'm Sam Lesante, and remember, we're on HT if you're watching us on the Service Electric Cablevision, channel 513. Well, another day, another show of information on our health network. Lehigh Valley Health Network, just as I told you, just gets better and better, folks. We have on the show today, no strangers to our area, husband and wife. Yes, Dr. Adrian and Emilia Secheresiu. Am I saying that right? Yes. Secheresiu, from Romania. Okay, and we're going to learn a little bit about diabetes and also AFib. As you know, folks, you can always get information on the show if you go to, if you call them, if you need an appointment, it's 501-4LVH. But their profiles, a lot of doctors' profiles are on lvhn.org/findadoc. I think that's very interesting. Well, it's nice to have husband and wife on the show.
Thank you.
Good. And both from Romania, correct?
Yes.
All right. Now, so let me ask you this. Dr. Adrian, when did you come over from Romania?
In 1968, we escaped from Romania as it was a communist
You escaped.
regime.
And how did you escape?
Through Yugoslavia with our parents. And
The entire family?
Just the three of us.
Just the three of it.
And then we moved over, first of all, into Indiana. And we were there for about 6 months, and then we moved to Freeland.
Yeah. So when did you become a doctor?
After we were here, I finished my education in the United States.
You started in Romania?
No, well, high school, and then I finished here.
Your medical degrees?
Yes,
Okay.
medical degree back to Romania.
Okay.
So after I finished high school here, I went to college, and actually graduated from Temple University, and then I went back to Romania to medical school as an exchange program. There were 20 students from the United States going to Romania to study medicine, and 20 students from Romania with full scholarship came over to study engineering.
Okay.
And
So when did you meet this beautiful bride of yours?
in medical school after 3 years.
Okay. So when you escaped, you do not know Emilia, did
No.
you? Okay. So you met her when you went back to medical school?
Yes.
Okay. And then when did you come over?
I came in 1985 after we got married and I graduated from medical
school. You got married
school.
in Romania?
Yes.
That's good. Interesting that, did you graduate? I'm sure you graduated before she did, right?
1 year apart.
1 year, okay.
84, 85.
And did you specifically major in anything in your medical profession?
Well, just medical school, and then after we came to the United States, we had to go through the equivalence of all the diplomas, and then we did the residency program outside of Pittsburgh, McKeesport Hospital, for 3 years as internal medicine specialty.
And you're internal medicine as well?
Yes.
Yeah. Now, when you met, okay, did your family come over from Romania?
No. Our parents came from the same community in Romania. So we met being in medical school and visiting our family at home.
It must be an interesting story of why you left and how you escaped. When you say escaped, it's people hear that, but they don't know what really is involved. And I'm sure it must have been a very trying experience on the families.
It was, yes.
Well, I'm glad that you're here, and I'm glad that you're doing well. You've been in the area for some time now, right?
I came here in '85 because my in-laws lived in Freeland. Shortly after, we moved to Pittsburgh for our residency, and from there we went to Miami Valley Hospital in Dayton, Ohio. We practiced there 3 years, and the family called back, family, friends, so we returned back to the area because it was home.
Oh, that's terrific. Yeah.
So we are here since 1993.
Why did you become a doctor?
In Romania, when I grew up, the medical system was very, very poor. And I've seen a lot of people not being treated correctly, dying too young, unnecessarily. And that had a big imprint on my own family. So at the age of 12, I already knew that this is what I would like to do. I never dreamed that I will make it so far and end up in the United States and be part of where I am now.
It must be an interesting challenge, huh?
Very much, very much.
And when did you decide doctor?
I've pretty much always wanted to be a doctor. As little kids, we used to play doctor.
Well, I used to play other things, but
and afterwards, I just felt it was my calling for it. I really loved it, and I thought I could help and add.
I always say that, you know, in anything that you do, all right, if you have a passion, okay, and you need that passion, just to have a job, just to be a dentist or a doctor or lawyer or a TV host, etc. You have to have a passion for that. And the passion then, I think, comes across in what you're able to do in service your patients. Am I correct in saying that?
Yes.
Yeah.
Yes, absolutely. I think so. It's more than a job. It's a, like you said, a passion, but it's a dedication, a lifelong dedication. And that's the only way you can practice medicine if you fully dedicate yourself to the practice.
You know, I tell everyone I'm the biggest baby when it goes to doctors because I believe me. I mean, Benyo, like when I walk in there, my blood pressure is like 195 over whatever. Because if I have a pinch, I've died of cancer. So, but the demeanor, I think, you know, what you have, you know, sometimes when they say it's a big hospital or a lot of doctors, I think when you boil down to the demeanor of doctors, when you're dealing with your patients, because listen, they're coming in, some of them are sick or whatever. It's how you know, relate to them, you know. And so I think that's, you know, why, from what I understand, people love you, the both of you, okay? Lisa was saying this before the show, you know, how, and so you've earned that. And I think you have to have that compassion. The thing is, how are you emotionally when you're dealing with your patients? Because you get involved with your patients. How does that work?
I think as a doctor, you need to be very good at what you do professionally. But I think you have to make the patient realize and know and understand what is wrong with them. Why do you do the test? Why do you give the medication? What is the final goal? And I think if you explain that to the person in lay terms, I will talk to you the way I will talk to my mother or my friend or my neighbor. So you understand why we are doing this. I think you achieved your goal. So you have to know your job as a physician, but the big terms that we use should be maybe used in conjunction with other physicians, with other specialty, but for a real person, you need to use real words.
And that's how you
Yes.
get your communication. Dr. Adrian, when you're looking at internal medicine now, what does what does internal medicine mean versus a regular, whatever, medicine?
It involves more training, and if you compare a general practitioner and internal medicine, it is a specialty, and it is for adults. We usually start our age group around 12, 16. Why? Because after 12 years of age, the doses of medications are considered adult.
Okay.
So we go all the way to beyond 65.
I didn't see that yet. I'm still in my 40s.
Yes,
So,
We go to the end.
So it is, and it's actually a very comprehensive specialty because it involves all the organ systems.
Yeah.
We are the first doctors that see patients, and then we need to sort things out and get all the workup started so that they can achieve a diagnosis. So, and we freely use consultants when we need something done that's beyond our scope. So I think we're the forefront of the whole medical.
one of the areas that we have down here is diabetes mellitus.
Yes.
Okay. And it's interesting. Mellitus is a Greek word, right?
Yes.
And it means sweet.
It means honey.
Honey.
Yes.
Okay. So if I call my wife Mellitus, do you think she'll give me a backhand? Hey, Mellitus, come here. You know,
It has to be a little bit more endearing.
it means honey, right? I mean, so
Yes.
I could say, you think I'll get away with that? Emilia?
No.
No. Okay. All right. What is diabetes mellitus, doctor?
Diabetes is a very complex disease. It's mostly a genetically started process that is then eventually molded by environmental factors as well. And it can come at any time, and it may skip generations. It's more and more understood. It's not a curable disease, but with the research that's been going on, it has been most difficult in the beginning because they thought it was just a matter of having high sugars. So you bring down the sugars, you'll be fine. It became to be not true. There's a lot of research that went into it, and there's different mechanisms now that we recognize which then triggered this entire process of the pharmaceutical companies coming up with new medications that address different places and different mechanisms of action to better control this disease. It's not curable, as I said before, but with the advent of all the technology, the diagnostic tools, and the armamentarium that we have with medications, it is better treated.
Well, are you born with this?
Yes, it's genetic. However, it can skip generations, and that's why a lot of people say, how come I'm the only one that's diabetic in my family?
Okay.
Well, first of all, it can skip generations. Second of all, 2 or 3 generations ago, not too many people kept very good medical records. So
Yeah, how do you know if you have it?
well, that's a very good question. You don't. And what
You're
happens
not helping
is,
me here, Doc.
Yes.
You're not giving any help.
No. What happens is many times the diagnosis is started by, for instance, women going to their gynecologists. They have frequent urinary tract infections, yeast infections, and then the gynecologist finally says, go be checked because yeast infections can be a sign of diabetes. Ophthalmologists also many times start the diagnostic process because the eye in a human being is the only place where you can see the very, very small blood vessels, the tiny arteries and the tiny veins. And by looking into your eye, the ophthalmologist can see certain changes that then starts the process of go to your doctor, make sure you're not diabetic.
Well, if you do a yearly, if a person's going for a yearly checkup, do you check?
That's another way. However, not too many people come to the doctor.
Well, which is sad.
Unless
Which is
it's
sad.
bleeding or it hurts.
Yeah.
When there's a lot of pain involved or something is bleeding, then they come.
Yeah.
And then you do a routine screen and you can pick them up like that.
And that's what happens with, like when I go
A
to
lot.
Benya once a year, you're doing all
Yes.
these tests, urine tests, whatever.
Exactly.
Yeah.
Plus, a lot of the fairs, the health fairs that they
Yes.
have locally, where you go and check your blood
And
pressure.
Lehigh Valley Hospital is very into the health
And they
fairs.
do. And
So you have, if you've had diabetes in your family, the best thing is certainly go and get checked. I mean,
Yes.
okay. All right, so you have it. So what happens now? Is there degrees of that diabetes?
Well, there's different types of diabetes. Obviously, the worst kind is type 1 diabetes mellitus, which is most of the people are being born with it, where
Okay.
you have no.
Is it treatable?
Yes, it's treatable with insulin from birth. Those guys are very sad. They are born with it. The majority of the people who have diabetes is a diabetes mellitus type 2 that develops anytime in adulthood. It can take all the way to 50, 60 years of age to start coming through. And that slowly progresses, and that's more treatable because you can do a lot more to affect the progression of the disease.
You really have to take care of diabetes because what could it do for you if you're not taking care of it?
Well, the end points of diabetes, because it affects mostly the small blood vessels and the small nerves, obviously you can end up having a stroke, you can end up having kidney failure, to be on dialysis. A lot of people end up blind, unfortunately, and a lot of people end up mutilated because it works on the circulation, and slowly but surely you can lose legs, feet, amputations, all that.
What age do you find mostly that have the diabetes? I mean, I know it can start from young ages, but what's the general age that you find with your patients?
Some statistics, just as a general thing, I looked this up because it was mostly
Because I'm
more
intelligent in
recent.
answering these
Yes.
questions.
Well, first of all, it's the 7th leading cause of death in the United States.
7th.
Seventh,
Yeah.
7th, right? And there are about 29.1 million diabetics in the United States.
Wow.
Out of which about 8 million don't know they have it. And this is that
That's-
category that
yes,
gets.
yeah, yeah.
And it's about 1.7 million new cases of diabetes per year. Adults 20 years and over have a 1 in 10 chances of becoming diabetic if it's in their genes. And adults over 65, it's 1 in 4. So it really goes up
Any
there.
telltale signs, for example, that you would look for if you feel like?
Yes, there are some general symptoms that you can go through where you would have increased thirst, increased fluid intake, increased urination, more hunger, you eat more, and there's weight gain, weight loss, depending on what exactly part of the time you get diagnosed. And then you start feeling weak and boggy and just not right.
The whole thing is get it treated as soon as
The
possible.
sooner you diagnose it, the better chance you have to prolong the income of all the bad effects.
But thank God we have it. It's something that can be treated,
Yes.
correct? Okay. I didn't forget about you, Emilia. I just wanted your husband to explain because I'm getting an education. I'm talking to doctors, I'm going to say this wrong, Doctors Adrian and Emilia Secheresiu. Secheresiu, okay. Romanian, they're in the Lehigh Valley health system now, but they've been around a long time. If you want to get in touch with them, it's 501-4LVH. And if you want to learn about their profiles, which I always recommend you doing, it's lvhn.org/find-a-doc. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. I'm talking to Doctors Adrian and Emilia Secheresiu. I'm doing all right with that, right? Romanian, and it's no stranger to the area. Remember, you can watch all of our shows on ssptv.com. My email is sam@ssptv.com, and you can go and find out all the information you want about doctors on lvhn.org/find-a-doc. Now, Emilia, back to you. AFib, okay? What is it?
Atrial fibrillation is probably the most common, what we call supraventricular arrhythmia. And what it means is your heart has an irregular rhythm. Because of that, it gives you symptoms where you feel very tired, short of breath, you feel palpitations, sometimes you have chest pain. Some people don't feel anything specific and it's being ignored. The disease is extremely common. There are approximately 6 million people with AFib in the country. About 2% are less than 65 years old and about 9% over the age of 65. It's interesting, women are more affected than men because women live a little bit longer and the disease gets worse as you age. It's
a disease.
It's a disease and it needs to be treated because the consequences of atrial fibrillation are devastating, the most common being stroke. A lot of people don't have any symptoms, preliminary symptoms. They end up with the first presentation being a stroke. And the stroke is a devastating event that compromises the quality of life forever. So I think it's very important to be recognized, diagnosed, and treated.
So here again, you guys are scaring me here today, okay? It happens in men as well. Right?
Yes,
okay.
it's
but
more
you're saying
prevalent
predominantly
in
with
women.
See, I guess women die of heart attacks and a lot
Well,
quicker.
women get the AFib around age 74 and men around the age of 65, 66.
And how do you know you have it? I mean, how do you, if you...
Eventually you will feel symptoms, shortness of breath, fatigue, and palpitations.
Okay. So if I'm, because right away, if I had that, I already have AFib. It could be something else. But so someone's out there and says, okay, what do? They come in and get it. How do you detect whether you have AFib?
First of all, they come in the office and obviously there is a physical examination. We do an EKG. Even if the EKG is normal, if you have a clinical suspicious, as a physician, you have to do further blood work. And if we cannot demonstrate any cause for patients' complaint, then we do further studies, Holter monitors, echocardiograms, stress tests, to find out why they have these symptoms, okay? Most of the time, we find it when they present in the office or at times on these event record monitors, where intermittently they have the symptoms and they are not even being aware that they happen. This is called paroxysmal atrial fibrillation. It lasts maybe less than 7 days, and eventually it will become permanent.
Now, so, okay, you find out a person has AFib. Okay, what do you do?
Well, atrial fibrillation, if it's less than 7 days, you can try to convert the rhythm back to normal, and that could be done with medication or electric. If it's of a longer duration, then there are different ways to treat. Some people need just control the heart rate because it could go up to 160, 180 beats per minute, and that is very disabling. So for some people, we control the rate. Some people, we return back to normal rhythm using different techniques. And the most important thing of all is if you have it, you need to be anticoagulated. You need to go on blood thinners to prevent a stroke.
So you're saying mostly elderly people over 74 is the highest majority?
In women, in men over 66, but
Okay.
usually elderly, yes.
Yeah. And they could feel whether they have something going on with it?
Most of the time there are some symptoms even though they are not specific, so people will know that something is wrong with how they feel.
So you say you have medication
Yes.
and electric.
Medication, you can do a cardioversion. The cardioversion could be electric, usually that's in the hospital. You can do
What is that?
Basically, you apply an electric shock. It's done controlled under sedation, and hopefully that restores the rhythm back to normal. And then you use medication to maintain the rhythm. You can use medication from the very beginning. And these are very specialized medication that tend to return your heart into normal rhythm. If the medication will not achieve that, then there are procedures called catheter ablation, where they use either cryo technique or radio frequency ablation techniques, where literally they try to identify and destroy the fibers that obviously in a pathological way triggers AFib.
Okay, so now, is this something that you're born with, or is this something that happens?
You
okay.
acquire.
So what type of quality of life should people be looking at? I mean, for example, if you're way overweight or if you smoke, is there any telltale signs out there saying, look, I know you don't have the magic wand, we all wish we did, but you said you're not born with it, so it comes from your lifestyle?
It could be a multitude of things. Some of them are cardiac, and some of the cardiac causes could be you are born with it. It could be totally non-cardiac, which are other medical illnesses, or it could be overweight, smoking, drugs, alcohol, excessive caffeine. They can trigger these episodes. So it's very important first to identify the cause, and once you identify the cause, if you can eliminate it, actually you can cure it. If you cannot eliminate the cause and you are into a permanent atrial fibrillation, then you have to treat.
So on a priority level, okay, what would be the main cause? You mentioned what would be like I know they're all causes,
Yes.
but what would be like, this is really...
Hypertension and aging, uncontrolled hypertension. Hypertension accounts for about 20% of the atrial fibrillation.
How do you control your hypertension?
Medication, lifestyle changes.
Okay.
Very similar with what I mentioned
So
before.
if I'm smoking a pack of cigarettes a day, is that a good thing?
No, and you have to choose between being treated for AFib and being on blood thinners or smoking.
I can't understand something, Adrian and Emilia. I see these young high school kids and young college kids and young people in their 20s and 30s, beautiful people, handsome, and they're puffing cigarettes. I mean, I know it's an addiction, but isn't that sad? Every doctor I've had sit here where you sit have said over and over again that it is not good for your health. Why is that, Emilia?
I think it's, first of all, lack of education, understanding that if you do, it will harm you forever. And there is a lack of responsibility. I look at it as a lack of responsibility. If you are a person that cares for your family, your wife, your children, and you do something that harms you, you have to stop. That's your responsibility to your family.
My wife's a registered nurse. She says exactly what you say. If you care for your family,
you take care of you.
You take care of yourself.
Set an example, and then your children will not smoke, will not drink.
Speaking of children, you have a son, Paul, right?
Yes, one son.
And where is he now?
Cedar Crest, Lehigh Valley Hospital as a resident for internal medicine.
Terrific.
He wants to do cardiology.
I wonder who he took after. Is there a lot of medical people in your family?
I have my aunt, my father's sister. She's a radiologist.
Is she here in the United States?
No, she's in Romania. And her son is a dentist. That's about
there you go.
all.
How are things in Romania?
Now they're wonderful.
Yeah.
Improving.
Yeah.
It's everything, well, it's democracy, it's free, everything.
Terrific, yeah.
Is the
We
way
take a lot of things for granted in America,
Yes.
don't we?
Yes.
And I'm sure that, you've seen it. Well, it was a pleasure meeting you again. I know we met before, but coming on the show. And, again, no strangers to Hazleton area, folks. Doctors Adrian and Emilia Secheresiu. Okay, I'm learning how to speak Romanian. And when I go home tonight, I'm going to say to my wife, come here, Mellitus. And she's going to say, what? And I'm going to say, well, doctor said that means honey. Remember lvhn.org/findthedoc, folks. You could learn all about them. And thanks for coming on the show.
Thank you
Our
for
pleasure.
having us. And
Thank
call us tonight after you call your wife.
I say, Adrian, it didn't work. Emilia told me, when's it going to work?
It might do bail you out.
What happened to your arm? Were you punching people or what? See, this is what happens when you don't take the medicine from doctor. What happened to your arm?
The response to this is she pushed me, but she did not. I fell by accident and broke
Thank God
three
you-
little bones.
Did you? Well, I'm sure you went to a good place to get them taken
Yes.
care of, right? Well, thanks again for coming on the
you.
show.
Thank
Folks,
you for
remember LVH.org/findthedoc. 501-4LVH is the phone number. We'll see you next time.